A 30-year-old woman with suspected pelvic inflammatory disease has worsening of her symptoms of lower abdominal pain despite being treated with oral metronidazole and ofloxacin. That means the patient is already on antibiotics for 14 days, but still her symptoms did not improve, rather worsened. She is suffering from pelvic inflammatory disease. She has a temperature of 38.6 degrees Celsius, yes, raised temperature and heart rate of 85 beats per minute and blood pressure of 110 over 80 millimeter mercury. Let's show what Darson. What is the single 18 into 10 to the power 9 per liter? CRP 160 milligram per liter. What is the single most appropriate next course of action? Single most appropriate next course of action would be another investigation to check whether the diagnosis was correct. Is that not? Yes. Endocervical swab? No, the investigation would take a lot of time to receive the report, so we can't wait that long. Pelvic ultrasound? Yes, it is an option. Laparotomy? No, we can't open the abdomen, it's too much big of an operation. Vaginal swab takes time. Culture? No need to do urinary culture, we can do a pelvic ultrasound. Yes. So why we will go for pelvic ultrasound? A high vaginal swab or endocervical swab can take to return days with results. So both of these are out of the question, as we have already discussed. Ultrasound scan is the diagnostic imaging method for choice for acute pelvic pain and in gynecology. So number one choice of investigation in gynecology and obstetric department is ultrasound scan. Is the diagnostic imaging method of choice for acute pelvic pain in gynecology. It can easily diagnose the sequelae of PID, including biosalpinx and tubo-ovarian abscess. So it can easily diagnose the sequelae of PID and tubo-ovarian abscess. Laparoscopy would be the next step after finding a mass on ultrasound. After we find the mass on ultrasound, we will go for laparoscopy, not laparotomy. Laparotomy is the later emergency case. So we will go for laparoscopy after we do the ultrasound scan. Okay, the urine culture has no role in diagnosing of pelvic abscess. So out of the question. So next question. 29 years old woman recent cervical smear results show inflammatory changes without any dyskaryosis. Sorry.